Good morning. Let me begin with salutations to our esteemed colleagues at this symposium. Honorable Umi Mwalimu, Tanzania Minister of Health. It is an honor to be here with you and to meet you and your delegation. Ambassador Michael A. Battle Sr., United States Ambassador to Tanzania and US agencies including CDC and your delegation. The UNICEF delegation. Professor Mark Elliott, Vice Provost for International Affairs, Harvard University, and Chair of the Board of the Africa Academy for Public Health, and your delegation, of which I think I am a part. Founding members and board members of the Africa Academy of Public Health, Professor Wafai Fauzi, Professor of Nutrition, Epidemiology, and Global Health at the Harvard T.H. Chan School of Public Health, Professor Till Barnighausen, Professor and Director of the Heidelberg Institute of Global Health at the Faculty of Medicine at University of Heidelberg, Mary Monica Sando, Chief Executive Officer for the Africa Academy of Public Health, representatives of local and international research and academic institutions, government officials, chief executive officers and representatives from various local and international organizations, and invited guests. Ladies and gentlemen, I am happy and honored to be part of this exciting symposium. I'd like to thank the organizing committee involved in the preparation for bringing us together this year to discuss and share expertise on matters pertaining to transforming adolescent health and nutrition research into actionable practice and policy in sub-Saharan Africa. Looking at the symposium agenda today, I'm excited to see the presentations and panels that I am confident will stimulate deep discussions around how to best transform adolescent health research into policy imperatives across sub-Saharan African countries. I believe the audience gathered here today is unique as it encompasses representatives from the ARISE Network partner countries, as well as representatives of ministries, donor agencies, local organizations, and academic institutions who are all experts in the field of adolescent health and policy. I look forward to hearing and participating in this symposium today. I think we can all agree that adolescents are among the most important and yet the most vulnerable age groups within our population who undergo numerous physical, psychosocial, and cognitive changes. I know this to be true because I am a mother of 2 adolescent boys back home. They are also crucial to our collective future. Despite their importance, adolescents face numerous public health challenges that hinder their ability to thrive and contribute to our communities. I'm proud to note that adolescent health has been a long-standing research passion of mine. Areas such as nutrition, mental health, and infections such as HIV and HPV continue to have detrimental consequences on the health and well-being of adolescents globally. The statistics and evidence on adolescent health continue to be alarming around the globe. Many low and middle income countries face a unique challenge of the double burden of malnutrition. While combating infectious diseases, they face a rapid surge on non-communicable disease risk factors, such as overweight and obesity. Once considered a high-income country problem, overweight and obesity are now on the rise in low and middle-income countries, particularly in urban settings. The prevalence of overweight and obesity among children and adolescents has risen from 4% in 1975 to now 18%. WHO also reports that 1 in 7 adolescents experience mental health conditions that are mostly unrecognized and therefore untreated. It's also reported that globally, 3.6% of 10 to 14-year-old adolescents and 4.6% of 15 to 19-year-old adolescents experience anxiety disorders that can result in social withdrawal, as well as affect school attendance and performance. The myriad of issues underscores the importance of adopting a multi-level, integrated approach to address these problems together rather than focusing on single, siloed issues. These problems also demand that we design and implement programs that can be delivered in settings, such as schools and communities, where adolescents spend most of their time. It remains vital to recognize that adolescent health is multi-sectoral in nature And in order to ensure we succeed in addressing these challenges, meaningful integration and collaboration are necessary. The successful execution of multi-center, multi-country studies and programs aimed at addressing the challenges in adolescent health will depend on collaborative and research initiatives that are innovative. The ARISE network in particular stands out as a key contributor to such endeavors in the region. In order to address adolescent health, and especially nutrition, we must recognize the interlinks between sectors such as agriculture, health, and education at multiple levels, such as school, family, and community. All these are key in ensuring that ultimately adolescent health interventions and evidence-based findings can result into meaningful policy change and improvements in adolescent health within our countries. Ladies and gentlemen, thank you again for having me. I look forward to engaging in this symposium. Asante sana.